Greetings and welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps including Apple Podcasts, Spotify, Pandora, and many others. Episodes of the podcast also air each Saturday at noon and Sunday at 10 a.m. on 100.5 FM, 92.7 FM, and 820 a.m. across Central Virginia. Please send any questions, comments, or feedback to pcfpodcast@vhha.com. Again, that is pcfpodcast@vhha.com. And today we're excited to be joined by Keith Hare, who is the president and CEO of the Virginia Healthcare Association and the Virginia Center for Assisted Living, a member organization for nursing homes and assisted living facilities in the Commonwealth. Keith is also a former Deputy Health and Human Resources Secretary in the Commonwealth of Virginia. Today we'll be chatting about the impact of COVID-19 in the nursing home community and more. But first, welcome to the program, Keith.
Well, thank you, Julian, and it's just an absolute pleasure to be with you today. And, one thing that you forgot to mention is I'm also an alumni of the Virginia Hospital and Healthcare Association. It's really how I came to the Commonwealth 20 years ago. And if it wasn't for just, some incredible leaders at that organization, I wouldn't be fortunate enough to be able to work with providers across the Commonwealth for the last 20 years. And so I just will always owe, my career to the Hospital Association.
Well, it's good of you to say that. I was aware of that, but I didn't want to get too insider, so I omitted that. But I'm glad you added it. So, as we mentioned, the Virginia Healthcare Association, the Virginia Center for Assisted Living, represents hundreds of nursing and assisted living facilities in Virginia that are home to thousands of older residents and patients, many of whom may be medically vulnerable or fragile. I think most people, Keith, know that the pandemic was particularly challenging for residents and staff in congregate care settings. It's important to note that Virginia is fortunate that despite the serious challenges faced by providers across the continuum of care in dealing with COVID-19, that the difficulties encountered here were not as severe as they were in some other states that were particularly hard hit. With that background, Keith, as you look back at the past year, what observations and insights can you share about the challenges encountered and overcome by your members in the nursing home and assisted living community?
Well, the first thing is I'm incredibly proud of the caregivers and the residents for everything that they've been through. Everybody's been hard hit by the pandemic, but the main thing is that they've really persevered through some really tragic situations. This time last year we were really trying to get our arms around what this pandemic would mean. The thought of testing residents in nursing homes, all residents, even though they were asymptomatic, was something that we had not come to grips with, and now that's something that is required, either monthly or twice a week or even once a week by the federal government. And, we think about the challenges with PPE. This time last year, we had facilities that were out buying, paint coveralls to use as PPE. We never thought that, N95 masks would, the possibility that they would be cleaned and that you could reuse them. We had, facilities that had large outbreaks that, that were really in desperate need of gowns. But, we had caregivers that continued to go into work, even though they didn't have the tools to really fight this war and to help the residents the way they needed to. So, for me, I always think back to the early days of the pandemic and just really how far we've come, with what we know about the virus and the ability to really protect the residents that are in the facilities.
And that's great perspective about the commitment and dedication and sacrifice of the caregivers in the nursing home setting and in other healthcare settings who really were on the front lines dealing with the patients impacted by this virus. So appreciate you sharing that point of view. You talked about the impact on your members. I wonder, for your organization, how did this emerging pandemic shift the way that you and your team have to operate and function to respond to the emerging challenges?
I mean, quite honestly, up until recently, it's the only thing that our staff focuses on. And we have to, because, being partners with the government, being partners with other providers, which is, included all of the hospitals in the state, the physician community. We can't say enough about what the state and the federal government have done, and the local governments through the health departments, to support these facilities. Nursing homes and assisted living providers, I mean this in the best possible way. They provide amazing care, but they're not, it's a post-acute care setting. It's not an acute care setting. And so their ability, when this pandemic began, they just didn't have PPE, and they didn't have the facilities to separate residents the way we know they need to now to ensure that things don't spread. And so all of that training, all of the additional regulation that goes into that, the increased cost for these facilities to take care of the residents is, our members look to us to help them, move through, the pandemic. And so we've done that, obviously, through working, closely with our members, because we don't want to ask for things from the government and from other stakeholders that they don't need. But that's really, been what we have done 24/7. And I don't, that's not an exaggeration, because all providers are working 24/7. And so the association has an obligation to do that too on their behalf. So, we hope to get back to, like everybody, get back to normal sooner rather than later, but we're still very much in the pandemic. But our focus right now is really on ensuring that, we get to 70% of all individuals in nursing facilities, both residents and staff, that are vaccinated. So, those can become incredibly safe places for family to visit their loved ones.
And I'm glad you mentioned vaccinations, because that's something I want to get to in just a moment. But before we do, one point you made, I want to tease out just a second. You talked about the distinction that many of your member facilities are post-acute care. And I think that's important for people to understand. And in that light, I wonder if you could sort of help differentiate for the listener the difference between nursing home, which is a term that often gets generically applied to medically supportive residential facilities for older individuals, but that term is sort of broad, and I think people use it generically for assisted living, for skilled nursing, for other residential care settings, and some facilities may have different units within them that offer different levels of support. So for the uninitiated, can you just give a little bit of a summary or overview about the differentiation or the distinction between those different types of facilities or units within a facility?
Sure. The easy way to understand it is, and I think most individuals have had family members who have, been in a post-acute care setting. And so, nursing homes are the places to where if you break a hip or you break a knee, and you might have, a couple of comorbidities, maybe high blood pressure, you might be recovering from a stroke, you would go there and receive, rehabilitative care. You would go through therapy. We would hope that it wouldn't be more than 30 days, but it could be up to 100 days. And that's traditionally paid for by Medicare. That really makes up the majority. 70% of those individuals, tend to, go home after they receive their treatment. And then you also have a significant portion of the population, it's like the majority of individuals in a nursing home, who are on Medicare. And that's your longer stay resident. That's going to be over 100 days, and many times many years of their life. And in Virginia, they are very sick individuals. They have a number of comorbidities. They don't tend to be what we would call they're non-ambulatory, meaning that they need assistance to walk if they're going to get out of bed. So they're very, very sick individuals. If you move to assisted living, those are individuals that they have more functionality than those that are in nursing facilities. They're going to need help with a number of things that we take for granted. Making sure that we take our medication. Again, needing probably some assistance, with the eating, but not near as much as the individuals that are in nursing home. And then, kind of as you go down the continuum of care, you have independent living, and those are individuals that, again, they might have a comorbidity or two. They're able to take care of themselves very well. They might need someone to check in on them periodically, but health-wise, they're in really good shape. And so, that's really, when we talk about the post-acute care environment, those are kind of three of the main components. But you also have, home health care that's in there also, and then also hospice. So, but again, the main focus and the main treatments that are being provided are within assisted living and then, nursing home level care.
Well, I appreciate that explanation. And let's now shift back to vaccinations. While the pandemic is still with us, as you mentioned, a lot of the current focus is on vaccination efforts. Residents and staff at nursing homes and healthcare workers were in the initial Phase 1A vaccine priority population when the first doses began arriving in Virginia in December. Today, according to the latest numbers, more than 3.1 million doses have been administered in the Commonwealth. More than 1.1 million Virginians have received 2 doses, and about 1/4 of the state population has received at least 1 dose. Obviously, this is a complicated process with its own unique challenges, but I wonder how you would characterize the progress on vaccinations among your members and the planning and prep work that went into that ongoing process.
Well, first I would say that we're extremely happy and just grateful for the priority that the governor, placed on those in nursing and assisted living communities. They were, as you mentioned, part of the 1A process. And the other thing, which a lot of people were not aware of, is that it was a federal partnership that was signed with CVS and Walgreens with the federal government to carry out clinics in for every nursing center and every assisted living center in the Commonwealth. And those are largely completed now. They had 3 clinics in each center. It took around 2 months, which if you think that there's about 900 nursing and assisted living centers across Virginia is absolutely amazing that they conducted those clinics in that period of time. And at the same time, they were also able to get to the majority of independent living providers, which was not a part of the initial contract. But when they recognized that many times those independent living providers were on the same campus as assisted living and nursing centers, they were able to also include them. So really a Herculean effort that CVS and Walgreens undertook, and they did it, largely, without running into any major speed bumps. And one of the reasons they were able to do that is because the Commonwealth put aside enough vaccine to ensure that when the clinics were organized and scheduled, that the vaccine was there to be given to the residents, and then also anyone who worked at a nursing or at assisted living center, which was just absolutely fantastic.
Well, it's good to hear about that progress and the success of the Pharmacy Partnership Initiative that you mentioned. And now that we've dealt with the technical stuff, Keith, I have a few other questions for you to give our listeners a bit of a sense of who you are beyond the work you do. First, and this is an entirely imaginary premise, but in the hypothetical scenario that you could anticipate your final day on Earth, what would your last meal be?
Oh my gosh. I love ribs. I'm very simple. So, I love, I'm from Tennessee originally. And so, good Memphis ribs would absolutely be it.
Okay. My wife actually got me a smoker for Christmas, so we've been experimenting with rib recipes. So do you like a dry rub or do you like a wet, saucy rib?
I love a dry rub. Absolutely love a dry rub.
All right. The next question for you, Keith, is what's the top item on your bucket list?
Oh, on my bucket list. Oh, my gosh. Honestly, in terms of travel, I've always wanted to go to Scotland and play golf with my dad and just spend a week doing that.
Okay. Which tees are you hitting from these days?
I'm getting close to 50, and I would take advantage of the senior tees. I'm not hitting much at all. To be fair, I haven't picked up the golf clubs in almost a year, and again, that's something I'm looking for when we have a little bit more time to do that.
Okay, sounds like a good goal. And then finally, if you were stranded on a deserted island, what one book, one album, and one movie would you take with you to keep yourself company? We will spot you a copy of the religious text of your choice. And I'm going to add one more caveat to this question specifically tailored for you. I'm going to restrict you from picking any album that includes Rocky Top. So with those caveats, what are your 3 entertainment survival kit picks?
And I want to make sure I've got this. I've got one book, one album, and I apologize.
And a movie.
And a movie. So I love the book, The Junction Boys, which is, you're going to laugh, it's about Bear Bryant, who is the longtime coach at Alabama. Mm-hmm. And for a Tennessee person to say that is big, but it's about his first team at Texas A&M. It's just absolutely phenomenal book if you're a sports fan.
They turned that into a movie, didn't they?
They did turn it into a movie, but like in most cases, the book is far better. And I'm going to continue the sports theme, which just kind of tells you where my interest lies. I absolutely love the movie Field of Dreams.
But baseball has marked the time. This field, this game, is a part of our past, Ray. It reminds us of all that once was good. And it could be again. Oh, people will come, Ray. People will most definitely come.
It's a classic.
Which just goes back to, just being a long time, love of baseball. Album. That is really tough. Everybody's going to go, who is this band? But, almost any album by a band that I've listened to for years and years called Jupiter Coyote.
Years ago, a child's brown eyes stared at the mantelpiece, wondered how the ship got in the battle. When it tried to find...
Started listening to them in college, and candidly, because if I listen to them, that probably means it's a sunny day and the windows are down, and and I'm in a good mood. So, but if I'm stranded on a desert island, that's and I've got to pick one, that's it. But my musical tastes are just, I'm from Nashville, so obviously I can go country if you need me to also.
Okay. Well, listen, I appreciate you joining us today and spending a few minutes with us and sharing your thoughts and views. And with that, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so that you know when new episodes are available. And we want to once again thank our guest, Keith Hare, the president and CEO of the Virginia Healthcare Association, Virginia Center for Assisted Living, and alum of VHHA. Thanks for being with us today, Keith.
Well, thank you, Julian. Thanks for all you and the Hospital Association does for the patients in the Commonwealth.